So you've been in an administrative leadership role, mentoring role, now not just in your own organizations, but across different ones. Who do you look up to? Do you have a role model, or where do you get a lot of your learnings from, apart from trial and error and the school of hard knocks?
Uh, I mean, as I said before, I totally stand on the shoulders of giants. I, I'm very lucky. I have, a wonderful, uncle, very, very, very close, very, very close family friends. I've had a mentor for, I guess the better part of 30 years, passed away a couple of years ago, but there was a very, very bright, talented, tenacious, savvy, communicator and business person who taught me a ton. I wasn't really great in school, but I was very fortunate to meet some, a couple of decent teachers along the way. And, I'm a part of a couple of, CEO and peer, I would say mentorship and professional and social groups. Um, and I often bring questions and challenges to them. Of course, I have tons, and the ideas that I get, and the advice and the wisdom that I get, the experience share that I get from those groups is, it's amazing. I'm also very lucky. Like our team, across all the businesses that I'm fortunate enough to be a part of. The teams are just so bright, and they all get and they all get my talents. I'm very good at a couple things, and I'm really awful at a bunch of other things. And I think a big key to success, whatever success is or means, is knowing not just your strengths, but knowing your weaknesses and making sure that there's people around that you can trust, making sure that there's accountability there, and then making sure that they're able to do the things that, you really shouldn't, you shouldn't be doing. But getting out of the way, I think is a key component of it. And, the mentors that I've had have done their best to not micromanage and to make sure that, the one team, one dream vision really can be realized.
It's kind of funny because there's different mentality in healthcare when it comes to the weaknesses versus the business side of things. And so in medicine, you're doing your training, and whatever your weaknesses are and your you know spots where you're not as knowledgeable or confident, right? There's just a huge push, like, okay, well, we got to touch that up and get you better at that, right? Because otherwise there's going to be danger and downstream impacts to care. Versus in the business world, it's like, let's just hire somebody who with a complementary skill set so you can focus doing what you're good at, and then the weaknesses just aren't as relevant because you have a team around, you know working together to actually accomplish those goals, and it winds up just being that much more efficient.
Well, I mean, yes and no, right? Like on the one hand, sure, but then on the other hand, every good surgeon needs the anesthesia team, right? And the anesthesiologist is like the bassist in the band. Like, they're so important. And whenever they talk to the patient always asks, "So when's my doctor going to show up?" Right? Like it's a
Get
very
snubbed.
needed complementary. Yeah, it's a very needed complementary function, and it's just always so totally overlooked. And the thing that's great about your practice that does not work in our world, right? And I'm sure you've seen, and I can't wait to have you on our podcast, because this is when you're going to be in the you get to be in the hot seat and I get to ask you these questions. But like you've seen in the business world, lots of people not willing to actually do their part and pull what they need to pull and do what they need to do. When you're on the ward, you're in the practice, and you're doing multidisciplinary care, you need to rely on somebody in the ER to be able to be there with you. They don't have to be your friend. You can hate their guts, but and you can count on them doing their job the best way they can and working with you the best way they can. And they won't put the politics ahead of making sure that that patient is okay. I think, in a lot of ways, you're very lucky that you get to work with teams that have to function together and have been trained to function together. Where, in our business, I've seen it in my own, and I've seen it with tons of business partners, right? Like business partners can tell you that they've got your best interest at heart, and they don't, right? They're watching after themselves. They've got their own interests. They've got their own agenda. It reminds me a lot of, this is probably not something we want to actually have on, I don't know if you can clip this, but, it reminds me a lot of, people talking about faith. When you see two Christians who just totally believe in faith, right? And they just see it from totally different places. Like, look at Ireland. Like, what a great example, right? Catholics and Protestants, violent opposition to the same to the same religion, same fundamental beliefs. In business, it's very difficult to find people who have your values, have your sense of integrity, and are willing to work with you in a way that you can actually work. So I think like it's not just about the strategy; it's also about the people, right? And
Yeah,
making sure that you
alignment
pick
to the
well.
vision, the values. No, that's all crucial to going correctly, right? 'Cause the sun, moon, and stars all need to align.
Yeah, yeah, and the
Well,
wind's
in
got to be
general,
right, and you got to work real hard, and hope, right? Like you got to, you can't, you don't have to be a person of faith, but you got to believe. Uh, yeah, opening a clinic is not for the faint of heart. There's no question about it. It's like a restaurant. Easier, I think, in a couple ways, but a lot harder, in many more.
if somebody's wanting to get their revenue and finances audited and optimized, where can they find you? What's the next steps?
Uh, Next steps are, we're on social. I can't say I'm a great Instagrammer, but you can definitely message us on Instagram, and you can send us an email. You can find us on the web at physiciansfirstfinancial.com. Um, and I think one thing that I will mention, because I didn't talk about, sort of enough, but there's a lot of people who come to our world, and I know, come to your world too, who are just like, just scraping by, and we didn't talk at all about financing and finance structures and the way that banks work and the way that MD Financial works as opposed to other investment groups, and ways that physicians can add a little bit more revenue and make sure that they keep cash in hand. Is it okay if I spend a minute or two just talking about that?
Please, yeah.
Um, you know, I was really inspired to spend some time with you and to start spending more time with Cherry when two things happened. Right. First one was, of course, that I met Alita and had a chance to chat with her a little bit and realized that a lot of the people that are coming to Cherry are coming because they need more money. They need to figure out what to do next. They're looking for their next opportunity, and they're cash strapped. And doctors can be cash strapped, right? When you come out of school, you come out with $200,000 to $300,000 in debt. You come out with a 20-year amortization schedule on your student loan at prime minus 1% or something. You get a $2 million line to go buy a condo or blow on some other depreciating asset. You get an operating line for whatever it is that you need, and you don't really know what to do with them. So maybe you lease a fancy car. Maybe you try to figure out how to refinance your whatever it is, but very few physicians are actually meaningfully invested in the right types of investments. A and B, no one teaches you how to be able to figure out how to manage your cash and bring in enough of it reasonably. And so, when Alita started to share with me that a bunch of clinics call and say, I need doctors right away, like right away, we're in real trouble. It occurred to me that if they're in real trouble, what it means is that the banks aren't necessarily helping them to, keep their financials running well. There is no support for them to be able to understand what the right steps are. And especially for the physicians, like nobody tells you, this is how you find clinical research work. This is how you get into med-legal work. This is how you can get out of dealing with Medicare. This is how you can bill private services. Nobody does that. And so we realize that, for those types of physicians, the physicians that are coming out that really are insured, banks, when you factor in the interest rate is kind of the lure, right? Prime minus one. Fuck, it sounds amazing. Well, prime minus one over a 20 to 40-year period, when you're paying a monthly maintenance fee, when you're paying your service charges, when you're paying all of the different,
Adds up.
fees that go with the term loan, you amortize that out, that is somewhere between 40 and 60%. It's a huge amount of money. In our model, we actually, if you use our cash, if you use our claim service and our dashboard service, we put the cash flow in for free. Like it literally costs no more to be able to implement it. And it's done like that so that you work on a Monday, you have cash Wednesday, you can pay for whatever it is that needs to happen between now and the 15th. You don't have to keep tapping that operating line. You don't have to keep using the Visa card at 20% or, whatever it is. And, you can start to get your cash flow right. If you pay off those debts fast, like just fast, just pay them down as quick as you can, you save a huge amount of money. And even though it seems like a small amount monthly, it's a small amount monthly that isn't helping you generate income. So it has an opportunity cost, and it has an opportunity cost for years and years and years and years to come, right? When you think about it like that, we work with one client, and they're fantastic. They're also on your they're also on your, they're also on Cherry, and I think they're going to come on the
Excellent.
podcast at some point soon. Yeah, the MedVisit group. They have it totally, and there's groups like this. You can call them and say, I'm a GP, I'm an emerge doc, I'm looking to be able to see patients, do home care visits. The pay is fantastic. The cash can come in very quickly. You can take the money and use it for whatever it is that you need on time. When you're making your payments on time and you're not using your operating line, your credit score improves. When you're being able to use those extra dollars to service the debt that you have instead of letting it just ride for 20 years, you save a ton of money. And if you have that debt available, you can use it to be able to generate more income. You can use it to be able to do things like tax deferment strategies and buy, investment properties or, fixed asset
Other
investments
things.
that end up cash flow. Yeah. Well, I mean, I don't know a lot about what you should be doing with it, but the reality is the low interest long-term debt can be a lot more expensive than people realize. And so, we're not asking if we can, mortgage your or finance your condo. That's not the business we're in. But the business we're in is at least in helping you understand, where your money is going. And that cost of that operating line over the long term is kind of like a loan shark rate, but you're just stuck paying it over 20 years.
It's a double-edged sword for sure. A lot of ski trips were enjoyed during medical school, but yeah, paying it back later now.
Well, there's something to be said for mental health, right? And however you decided to use the money, there's nothing wrong with going on that ski trip. But maybe the right way to do it or a better way to do it is work an extra day, make a few $1,000, and then don't blow the bank on the trip. Have a great trip. Make sure that it's done reasonably responsibly. Definitely don't break anything. Like I would never say go skiing, especially if you're a surgeon or you need to be standing all day. And then when you have that, when you have the income saved, then spend it. Or make sure that you're budgeting reasonably, right? So if an extra day of work is going to burn you out, then don't do it. But if an extra day of work is something that would really help you put another 3,000 to 6,000 into your spending allowance so that you can keep servicing your debt, or help you pay that off faster, or if you're recently divorced, you're just in a dynamic situation, don't put yourself in a harder situation because life happens. Figure out how to be able to manage the business smoothly so that you can at least keep that part of that core part of your life stable.
I'm Dr. Jordan Vollrath, and you've been watching Cherry Live, brought to you by Cherry Health. Please like and subscribe to see more clips like this, or check us out at www.cherry.health, Canada's medical network.